And the first thing to understand is how coronavirus is spread, and they spread from large droplet spread. So what that means is that the person who has it coughs or sneezes, big lumps of liquid, I guess, snot, saliva, whatever, come out that have got virus particles in them. And the implication of them being big particles is they come out and they drop with gravity. So probably within a metre radius of the person going in the direction. So it's a kind of spray as opposed to a cloud round about the person. And the 2 metres distance actually just adds in extra kind of precautions for that. But the fact that it's a large droplet means that the PPE that we use reflects that. So you're probably most likely to get contaminated from touching hard surfaces that someone has previously coughed or sneezed onto, so that there's droplets there that contain the virus. So gloves are very important in terms of stopping you from contaminating your hands and then potentially touching your face to catch the virus. So you're not going to catch the virus, it doesn't go through your skin, but the worry about contaminating your hands is that at some point you then touch your nose or your eyes or your mouth, and the virus can get in that way. The apron, the plastic apron, protects the front of you, and a standard plastic apron is perfectly adequate for what we do. It's exactly the same as what we use in hospital for the vast majority of patients. It's protecting the front of your uniform essentially, or your clothing, from any spray. And then thirdly, a face mask is probably in reality the least useful of all of the PPE that we use. But the face mask that we use, it's the same we use in hospital unless we're working in intensive care, is really just a fluid repellent face mask, and it's a physical barrier to any droplets that might get onto your mouth and nose when you're working. And that can either be someone coughing in front of you when you're there, or you actually touching the front of your face, which you need to try not to do. Eye protection has always been a bit of a concern for people. Eye protection, what does it do? Well, it adds obviously the same protection the face mask provides for your nose and mouth. The eye protection provides a barrier, so it protects your eyes. It's really going to add anything when someone might be right in front of you, coughing or sneezing right in your face, so direct contact, or I guess when you're doing things to residents that can kind of generate a spray or something from their mouth. So for example, in hospital I don't wear eye protection as standard, but if I'm going to do a nose swab or a throat swab or something, or look in the back of someone's throat, something that involves me being right in their face, then I will wear eye protection. And I guess it's up to you to decide when you're working with residents what sort of situations that would be. So for example, when you're cleaning someone's teeth, or when you're shaving them, or when you're in close proximity to their face. So that's what the different aspects of PPE do. So now we'll go to putting on. And putting on is a very simple procedure. I tend to start with the apron, just because it's easiest to start with. You're really just covering the front of your clothing with that. And yes, it doesn't cover the back. Yes, it doesn't cover my arms. And I would always work with patients with my sleeves rolled up and bare forearms. But it covers the majority of me, which is what I want. I can wear a full-length gown with long sleeves. Actually, that is more complicated to take off, and actually increasing the risk of me getting contaminated when I take it off. So this is a suitable compromise between that risk. More PPE does not necessarily mean more protection. It means more complications when you try to remove it. Standard gloves. Don't need to be long gloves, just standard gloves to your elbows is fine. because if I feel that my arms may be contaminated at any point, I'm going to wash them with soap and water before I leave the room. So standard gloves, perfectly adequate. And then a fluid repellent surgical mask. The way to put these on are to make sure that it hooks under your chin. So if you mould it to the top of your nose, really to keep it up rather than anything else, and then that tucks underneath your skin, and you don't want it billowing out to the side. But remember, the face mask is just a barrier, it's not actually filtering anything out, because that's not what we need for large droplet spread. And this is the PPE that we would use as standard in hospital for over 90% of the patients that we're looking after. The pictures that you see on television tend to be filmed in intensive care units where they are doing procedures to patients that involve making aerosols, which are much smaller particles and do form a cloud around the patient. So that's very specific stuff like intubating people, putting them onto machines to help them breathe, these sort of things that you would not be doing in this situation. And therefore you don't need the kind of full-length gowns that they're wearing, the fancy respirators that they're wearing. We don't need that. And as I said before, that just makes it more complicated to take off, increases your risk. So this is what we are using to look after most patients. Now we're going to take off, or doff as sometimes it's called, we're going to take off our PPE. And this is when we're probably at most risk, because this is when we're at risk of contaminating ourselves, either our skin or our clothing, from having worked. And this is why it's important that the PPE is easy and straightforward to remove. So we remove our most contaminated item of PPE first, and that's going to be our gloves, followed by our apron, followed by our face mask. If you were wearing eye protection, you would take your gloves off first, then your apron, then your eye protection, and then your face mask. So the face mask is always last, because it's going to be the least contaminated part of your PPE. So the first thing is the gloves. So we need to take these off in a way that does not potentially contaminate your skin. But we're going to do it slowly, and we're going to do it in a controlled way, so that if I do touch my skin, then I know that I've done that, and I can just wash that area or put alcohol gel on that area to take care of any virus that may have got on there. When we remove the gloves, we do it in a way where we don't touch our skin. So we're pinching the glove from the outside and rolling it off. So that's now inside out. And then the other glove going underneath the cup of the glove with my finger, pulling it over, and then taking the whole lot off. And I can touch that fine because that's the inside of the glove. So they're both inside out, and then they can go straight in the bin. Now, there is potential that I may have a few virus particles in my hands or my arms from having taken the gloves off. It's unlikely, but it's possible. So we're going to take care of that with some alcohol gel. And we're going to use alcohol gel between each step to be careful, but also to slow us down and make us think about what we're doing when we're taking the PPE. So, some alcohol gel on my hands, and I'm going to clean my hands. I'm going to let that evaporate. Give it time to evaporate. It's the evaporation and the drying out that actually kills the virus. So we're going to let that evaporate. Once that's done, the next thing, or the next most likely contaminated thing, is my apron. So we're going to take that off. And much like the gloves, we want to take that off in a way that essentially turns it inside out to minimise any potential contamination of me or my clothing. So the first thing I'm going to do, without touching the front of the apron, I'm going to tear the top of it, and I'm going to let that fall forward. So that's now the inside of the apron, and it's clean. Then I'm I'm going to undo the back, and you can see how a thin plastic apron, which is waterproof, is actually quite helpful here, because I can just snap and turn it inside out. So that's now inside out. This is the inside, so it's clean, and I can roll it up, touching only the inside of the apron, and then that can go into the bin. Now, it's possible that I may have picked up a couple of virus particles in my hands, so I'm going to clean my hands again with alcohol gel. We know that alcohol kills the virus. Good data now to support that. So we're covering my hands in alcohol again. Again, this is slowing me down, and it's making me think about what I'm doing. I'm going to let that evaporate. So my hands are now clean again, even if I had accidentally contaminated myself. So the next thing I am now going to take off is my face mask. If I was wearing eye protection, I would now take the eye protection off, trying not to touch my face, and I would dispose of that in the same way. And then I would put alcohol gel on my hands again before getting back to this stage again. So I'm now going to take my face mask off. If the face mask is contaminated, it's going to be the front of the face mask. So I want to keep that away from me as I take it off. So I'm taking the lips, I'm leaning forward slightly, I'm letting it come away from me, face forward, and I can drop that in there. And then I've got to clean my hands again, just in case I have contaminated my hands. And as long as I'm staying 2 meters away from the rest of them at this point, I'm fine. I'm not going to catch anything. I let that evaporate, and then I go and I wash my hands with soap and water. And that's how to doff.